Welcome to Dayspring Life and Health channel. Today we are coming to you again with a very important topic, and we want to talk about how to know that you are vitamin D deficient. How to know if you are low in vitamin D. And I'm going to outline about maybe six points to have you know or check to see if you are low on vitamin D. We know vitamin D is very essential for our well-being. Do you have enough vitamin D levels? How do you know? And that's where we're going to go over these points. The first point being that if you are vitamin D deficient or if you have low vitamin D levels, then definitely what will happen is you will have progressive, or what I would say chronic muscle weakness. You are definitely going to have muscle weakness for a long time. It's not just one day when you got tired because you exercise too much and your muscles are weak and you got achy and stuff like that. No, I'm talking about progressively long, or what I would say chronic muscle weakness. That will be a sign of low vitamin D levels. The second point that I would also want to talk about is bone weakness. A lot of vitamin D is used to convert or to absorb calcium. If you don't have enough vitamin D level, then what is going to happen is your calcium levels are also going to drop. And since bone mineralization is with calcium, eventually your bones are going to get weaker, progressively weaker, to the extent that you can break bones so easily because you don't absorb enough calcium from your gut because of low levels of vitamin D. And also, not only that, but especially in people who are a little older, you're going to have low density bones, what we call osteoporosis. So your bones are going to be less dense. So if you have been diagnosed with osteoporosis, which is basically low density bones, then obviously you're going to benefit from vitamin D. So that's a sign. Apart from the other things that causes osteoporosis, low vitamin D levels would also definitely lead to low density bones because obviously you are not getting enough calcium from your body. The third point for you to know that you're low in vitamin D levels is that you may have weak immune system. A weakened immune system is a definite sign of vitamin D low levels. When your vitamin D levels are low, you don't fight infections as well. And by infections, I would actually just pinpoint a few. Usually your upper respiratory infections, you get, flu, cold, all around the year. You are always getting the cold. You are always getting the cold or the flu. Every season you get it. Even out of season, you get sick with upper respiratory diseases, flu in particular. And recently with COVID also, people who are low in vitamin D tend to suffer more. Their COVID diseases are more serious than those who are high in vitamin D. And so if you want to know if your vitamin D levels are low, check how frequently you get sick. Are you immunocompromised? Are you, is your immune system so weak? In that case, you may have low vitamin D levels. And actually, studies have shown that of the people who died in COVID, most of the people who died in COVID were people whose vitamin D levels were extremely low compared to those who survive or whose diseases do not progress. Low vitamin D levels will definitely make you have weak immune system. So if your immune system is weak, check your vitamin D levels. You may be low in vitamin D. The other point is that apart from having the low immune system, vitamin D is also, studies have shown that vitamin D has been linked with insulin sensitivity. And so some people, especially people who are diabetic, find that controlling their blood sugar levels are more difficult because of low vitamin D levels. So if you are diabetic and you are finding it difficulty controlling your sugars, doing all the right things. I'm not saying you are eating tons of sugar, you are not taking your medications. No, I'm talking about somebody who is definitely doing all the things that they have to do, and yet there seems to be a challenge when it comes to controlling their sugars. Check your vitamin D levels. You may be low in vitamin D. And the studies also show that people who are not even diabetic, progressively low vitamin D levels can push them into high blood glucose levels, or what we call hyperglycemia, and eventually even get type 2 diabetes. You may be having low levels of vitamin D, which may be leading to high blood glucose levels. The other sign of vitamin D levels being low is heart disease, cardiovascular diseases, strokes and heart attacks and stuff like that. Well, you may not see that as obvious, but studies have also proved that most people with cardiovascular diseases, CVDs, have low vitamin D level. So definitely, if you have heart issues, ensure that your blood levels of vitamin D are on the normal point. And lastly, but not the least, low levels of vitamin D has been linked with depression, especially people with seasonal affective disorders, seasonal depression. People whose depression are only more pronounced in the winter months or in the colder months because they do not step outside. They don't get, obviously it's cold, they don't get enough sunlight to be able to make their own vitamin D levels. So just a little dip of vitamin D levels in the colder months, in the winter months, lead to escalation in their mood problems. And so such people have depression, especially around the winter or colder months. Now, for other places where there's no winter, you could still have depression if your vitamin D levels are continuously very low. So check if you are depressed. Are your vitamin D levels on point? You may have low vitamin D levels. Check your moods. Some people are chronically depressed, even in spite of treatment. They don't seem to overcome their disease of depression, their depressive mood, because their vitamin D levels may be low. You can find objective levels of vitamin D. In other words, you can go to your doctor and ask them to check to see if your vitamin D levels are on point, or if you have enough vitamin D levels, if your levels are low or if they are high. So that one is objective. That the lab will do it. They will tell your doctor you are low or you are high or you're normal. So this is where we end the video. We'll come back again with you on other things concerning vitamin D. But until then, we want to say that, beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching. Live videos on Sunday evenings and some other time in the week. All right, hope to catch you on the live this week. Thanks for watching.